Funding for this edition of Think Tank with Steve Adubato has been provided by the Russell Berry Foundation, making a difference. Horizon Blue Cross Blue Shield of New Jersey. PSE&G, committed to providing safe, reliable energy now and in the future. GIBBONS PC, the Port Authority of New York and New Jersey, moving the region through air, land, rail, and sea. The Northward Center, the New Jersey Economic Development Authority, Fedway Associates, Inc., and by Wells Fargo. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network. And by ROINJ, informing and connecting businesses in New Jersey.
Hi, I'm Steve Adubato. You can tell we're, like everyone else in the broadcasting industry, we're taping, producing remotely, and we are honored to be joined by the senior senator, United States Senator of the great state of New Jersey, Robert Menendez. Senator, how you doing?
Good to be with you.
Senator, as we tape this program on May 13th, so many things, moving targets. Every day there's a new piece of legislation you're involved in with someone else on the other side of the aisle, your colleagues as well. What is the number one issue you see facing our state and nation today?
Well, Steve, the only way that we will get to somewhat of what I would call a new normal is by near universal testing and community contact tracing. And why do I say that? In an economy that is controlled by largely consumer spending, you need consumer confidence. And unless we can tell New Jerseyans that their visit to the mall, to the restaurant, to the hairdresser, to the public square has been dramatically mitigated in terms of the risk that they will contract the virus, we're just never going to get there. And so this is why I pushed real hard in the last COVID bill that passed into law, $25 billion for testing. But there's more to be done in that regard to get to where we need to be. There's a lot of other things, obviously. You said the number one thing. For me, that's the number one thing, because the nation's wealth and the state's wealth will only do better with the health of our people. And I think if we get that going, we get a lot of other things going. We still have to help our small businesses. We have to help the state and municipalities. They're just facing a shortfall. It has nothing to do with their making.
Well, Senator, I'm glad you mentioned that. Last time you were in the studio with us, we happened to be taping it with our partners at NJTV in Newark. And we will be back there again, I promise everyone, when it's safe and it's right. But I remember you and I were talking about the partisan rancor, the polarization. And am I naive to want to believe that partisanship, that polarization, that geographical, hey, blue state, red state, you're not us, you have the problem, it's not us, do you sense that your Republican colleagues from other states, more rural states, are sensitive to the plight of a New York and New Jersey and the horrific conditions we're facing in the age of COVID-19?
Well, it's not as widespread as I would hope that their views would be, that they would understand. As I've said to my colleagues since we've been back to Washington, what's happened to us is coming your way, unfortunately. Hopefully it won't be as harsh, and hopefully you've had the time to learn from states like New Jersey and New York what's coming and be better prepared as a result of the advance warning. But it's coming to some degree. And I remind them that, when I've voted for, funding for flooding in the Mississippi, wildfires in the West, Hurricane Katrina, and on, I've never asked whether it's a blue or red state. It's why we call this country the United States of America. And so it's disappointing to hear Senator McConnell, the Republican leader of the Senate, talk about bankruptcy. His state receives $37 billion more every year than it sends to the federal treasury. So I don't begrudge them that money, but at the end of the day, you can't be talking about us in a way when that's the reality of what you've been achieving. So I've been saying we need everybody together, and I'm thrilled that I have a Republican colleague, Senator Bill Cassidy of Louisiana, join with me on this $500 billion assistance to state and municipalities. I think we're going to be announcing shortly a couple other Republicans who are going to join us in the effort. That's a good bipartisan effort. Hopefully it sends a message that this is about all of us, not just some of us.
Well, as we listen to Senator Menendez, by the way, we're producing remotely, and this program is being recorded on the 13th of May. It'll be seen after that. Check out our colleagues at NJTV News and Metro Focus for a daily report on what's happening in our region. But longer term, I don't want to go backwards, Senator, but I do want to get your assessment. And I know it's tough talking about President Trump because there's so much needed by a state like New Jersey from the White House, from the federal government. But how would you characterize President Trump's leadership here, A, and B? I just want to also get a response to the fact that he said he's in no way responsible for this. He did not cause this, but is he responsible for the conditions we face today and moving forward in any way?
Well, Steve, he didn't cause it, obviously.
Clearly.
This is a virus that began in China, although I think it was largely transmitted from all the evidence we're seeing now in the United States, largely by European visitors who contracted it from someone or persons who came from China. So he didn't cause it, but the response.
No, caused this condition we're in right now because of the initial response. I should have framed it that way. Yeah, I apologize, Senator.
Yeah, okay. Listen, we have lacked leadership both at home and abroad in this regard. States should have never had to compete with each other in the marketplace to get personal protective equipment, to get ventilators. There is a reason that a federal government exists. It's in moments like this of a pandemic that you need a federal response. And I think that the president has wanted to sort of like say, that's not my problem. It's for the states to resolve. It's for the governors to resolve. We can't do that because we have a national problem here. So I regret that he has not taken the bull by the horn, so to speak. I regret that he's not listening to his health professionals who, in fact, do, I think, tremendous work, like Dr. Fauci. But it is what it is, and we continue to work to try to overcome whatever shortfalls the executive branch has had, and try to get legislative support for the initiatives that will put us back on the road to recovery and get our people healthy again.
Steve Adubato here, Senator Robert Menendez, the senior senator in the state of New Jersey in the United States Senate. Let me ask you this moving forward. If, in fact, and this program will be seen later, as I said, this fall issue, fall 2020, if, in fact, COVID-19 returns in any form, to what degree do you believe that the federal government is prepared in a way that they were not the first time around?
Well, that's a great question, as you always ask great questions. And here's—
I don't have the answers. I just have the question.
Yeah, no. Well, here's my view of that question in terms of answering it, and that is, I still don't think we are as prepared as we should be, even though we are forcing the issue. It's tough to have oversight virtually. It's different when I can get witnesses in front of me and press them about, do we have a national stockpile ready to go for a potential second wave of personally protective equipment, of ventilators, of whatever antivirals we may have developed? Why aren't we at the table with Europe on what is a multinational effort to create a vaccine? That vaccine might be created in the United States. It might be created abroad, but either way, we want to get access to it, no matter where it's created, when it's created. These are the things that I'd like to see happen. I'd like not the states to— I don't want New Jersey to compete against New York for ventilators or personal protective equipment. I don't want to have to hustle across the globe to get stuff. And I'm not yet at the point that I'm ready to tell you that we are as prepared as we should be. We are pushing to make sure that we are, but obviously a legislative branch can only do so much to exert pressure on the executive branch to make the executive branch do what we would like collectively to see happen. And so we continue to do that. 30
seconds on this. I know we're dating ourselves in the middle of May, but the Senate hearing that just took place remotely with senators in a Senate room, but folks who were testifying remotely, Are you okay with that, or is that just the way it has to be?
Listen, it's the way it's going to have to be for a while, because if you put normally in the process of a regular Senate hearing, you put all the committee members, you put their staffs in, you put the committee staff in addition to regular staff, you put the people who operate the whole process. You're talking about 45, 50 people in a room that certainly there isn't social distancing unless you do these huge conference rooms. So the reality is, and you have elements of the population here that are in the risk category. So, we're going to have to do the virtual hearings as much as possible. But I think what we should be doing is hearings and focusing on all of our committees on COVID-19, not in pursuing judges that the ABA considers unqualified.
Senator Bob Menendez, I cannot thank you enough for taking the time with your busy schedule joining us. We wish you and your family all the best and continued success working on behalf of all the people, not just of New Jersey, but of the nation. It's never been more important than now. Thank you, Senator.
Thank you, Steve. It's never mattered more. Good luck, good health to you and your family and to all your viewers.
Thank you. I'm Steve Adubato. We'll be right back.
To watch more Think Tank with Steve Adubato, find us online and follow us on social media.
Welcome back. I'm Steve Adubato. We're now joined by Mr. Bob Garrett, who is the CEO of Hackensack Meridian Health. Good to see you, Bob.
Good to see you. Thanks for having me, Steve.
Bob, lay this out for folks. Hackensack, the first case of COVID-19 in the state?
Yeah, back in on March 4th. It seems like years ago, 7 weeks ago. And, after that first case came, of course, there was a huge ramp up of cases. And, the good news is we were prepared, but, you never can totally prepare for something so unprecedented. In my lifetime, I've never been through any of this. I think nobody really has, and being on the front lines of healthcare, my entire career, we've had to respond to other emergencies, Hurricane Sandy. We had the Ebola scare and the Ebola crisis, but nothing compared to COVID-19, just because of the numbers and the speed of which things happened and changed was really unprecedented.
Let me follow up on this. I want to be clear so people understand Hackensack Meridian Health is a system. And I know, and let me disclose, I've done leadership development, particularly for physicians, and talk about how physicians and their leadership, their job has changed people on the front lines. And also HMH is one of the hospital systems supporting what we do. Bob, let me ask you, there are 14 hospitals within Hackensack Meridian Health, but you also have other health care related affiliates, correct?
Yeah, so we actually are up to 17 hospitals now. Part of Hackensack Meridian, 14 nursing homes that long-term care facilities that we own, and of course that's been a major issue during this pandemic. But we have a host of other healthcare providers. We have physicians' offices, we have urgent care centers, surgery centers. Really the full continuum of care. So we're located in 500 different locations throughout the state of New Jersey, and even in terms of preparing for this pandemic, we had to prepare all of those sites. So it wasn't just the hospitals, but it was really a system-wide preparation that went on.
Well, let's talk about longer term, because if you want to check out, folks, if you want to check out what's happening day by day, Governor Murphy's press conferences, go to NJTV News, our colleagues at WNET as well with Metro Focus, check them out every day. We're looking at, dare I say, the longer term challenges. Bob Garrett, the long-term implications for hospitals, hospital systems, and the healthcare world, what do you see?
So I see, I certainly see healthcare being delivered a lot differently. So if you're a patient coming into our health network or most health networks now, you're gonna face, a different type of a care delivery experience. So as an example, in order for us to really get ready for the return of a lot of non-COVID patients, because we've been taking care of so many COVID patients over the last 7 weeks, we've taken a lot of steps, Steve. We have, as an example, every person that comes into our facilities gets their temperature checked. There are designated spaces for COVID and non-COVID. We've had to go through thorough cleaning processes. We're testing all patients coming in. We're testing many of our team members as well. So it's a different experience. And one of the things that they're gonna find is the idea of waiting rooms for outpatients. I think are going to be a thing of the past, because there has to be social distancing. So you're going to be actually called on your cell phone to come in when your appointment is ready, and you come right in from your car. You get your procedure, you get your test, and then if you need to leave, you leave at that point. But you don't interact with many people. So the world of healthcare delivery is going to change. Another element is telehealth. I mean,
Right.
we saw during this pandemic, telehealth really blossomed. People were receiving healthcare through telehealth, and we're actually, in our medical group, which we have about 1,100 providers in our medical group, we're actually almost doing the volume of patient visits as we did prior to the pandemic, but about half of them are being done through telehealth now. I think that change will be permanent. Another change is many of our team. We have 36,000 team members. Not all of them are on the front lines. Some of them work behind the scenes in information technology and finance and support functions. I think many of those people who have been working from home will continue to work from home. So I think that whole telecommuting trend is going to continue. But there's no doubt that this crisis, this pandemic, has taken a big toll on hospitals. Not just our infrastructure. Obviously, we had to order supplies and personal protective equipment in record numbers. We had to expand our capacity like we've never done before. Steve, we actually had to triple our intensive care capacity in a matter of days and weeks. And one interesting story is up at Hackensack University Medical Center. Literally within a couple of days, we were able to transform what was the cafeteria into a 72-bed COVID-19 unit. And kudos to our construction and plant operations folks. They did just a great job in a short period of time. So there is really, a new norm here, and there's no doubt that this has taken its toll on our infrastructure, but it's also taken a financial toll on the healthcare industry. And there's a big road ahead of us to have to recover. Certainly, from a financial perspective, revenues are down and expenses are way up to be able to take care of patients during this pandemic, and we have to keep it that way because there's a lot of predictions that we're going to get that second wave. So we need to make sure our healthcare system is as strong as possible from an infrastructure perspective and also from a financial perspective.
The plasma transfusion therapy, what is it and why is it so significant? Because I know that the folks over at CDI, which stands for the Center for Discovery and Innovation, right?
Right.
Are they driving that with Dr. Perlin?
Yeah, they really are, Steve. So this is really exciting. First of all, what a great story. So inspirational to see literally thousands of people who have recovered from COVID-19 donate their blood, their plasma, their antibodies to be helping patients who are now suffering with COVID-19. We've already done over 450 of these plasma infusions, and the early evidence is very, very hopeful. Again, we still don't have enough data to form any conclusions, but it really anecdotally, if you talk to our clinicians on the front line, you talk to folks like Dr. Perlin, who developed a serum that would be able to be infused with the plasma into patients who are sick. They're all very, very positive and optimistic about our early results. So keeping our fingers crossed, because as we all know, there's no vaccine yet. And this is one of the more hopeful therapies that have come out over the last 6 weeks or so.
You've been listening to Bob Garrett. I'm Steve Adubato remotely. He is remote as well on Zoom. I want to thank Bob Garrett, who is the CEO of Hackensack Meridian Health, for joining us. Bob, stay well, stay safe, and particularly to the physicians, nurses, and all the frontline folks. They are the true heroes, as you said, and many have said many times. Thank you, Bob.
Thank you, Steve. I appreciate you having me.
You got it. We'll be right back right after this.
To watch more Think Tank with Steve Adubato, find us online and follow us on social media.
Welcome back, folks. We are honored to be joined by Tammy Murphy, who's the First Lady in the great state of New Jersey and also the founding chair of the New Jersey Pandemic Relief Fund. First Lady, it's good to speak with you, even remotely.
Thanks for having me, Steve. It's always good to see you.
Last time we talked, it was Ab Drumthwacket doing a half-hour special on that extraordinary place. By the way, go on our website. You'll see it right now and check out that Drumthwacket special. Could you, for us, tell us exactly what the New Jersey Pandemic Relief Fund is? We'll put the website up, the dollars raised, what it's for, and the difference it's making.
Sure. So the New Jersey Pandemic Relief Fund is a nonprofit that we incorporated on March 24th Took about 10 days between the idea coming up and our being able to get all the paperwork done and have our first, our initial board join. We are basically here to help the on-the-ground providers who we know are struggling in the wake of COVID-19 to make sure that with the surge of new clients and guests they're trying to help, that they actually have the resources they need and are not going to fold. So we are basically here to help the most vulnerable across our state, and we're kind of filling in gaps, you know, where we know that there are state, county, and local resources. We know there are other foundations out there that are supporting certain organizations, but there are others that, you know, are really struggling. And so we are here to try and identify the needs and to help. We start out with a hierarchy of needs that include basically stopping the spread of the virus, supporting the healthcare community,
That's right.
and providing the socioeconomic support and relief required by our most vulnerable across the state.
You know, the concert that I saw
Yes.
that was all over everywhere.
Yeah.
The name of that concert was
Jersey for Jersey.
raised a few bucks.
It did. It did. We you know, most importantly, you know, that was an idea that I had, and I thought, dare I? And I reached out to John Bon Jovi and Bruce Springsteen and said, I have this idea. I want to give our state a virtual hug. And they said, oh, you want to do, you know, the national thing? And I said, well, not really. I kind of just want it to be, you know, exclusive to the New Jersey Club and have all of New Jersey's finest, you know, talents entertain and showcase our essential workers. And just basically, I mean, everybody was tired of being stuck inside. And I thought, if we could all do the same thing for 1 hour, wouldn't it be great? And they both said yes. And then it was just
Where Danny DeVito and Jon Stewart come from?
I reached out to Danny DeVito and Jon Stewart, but I had help. You know, each of the people who got involved ended up helping me reach others, and it really became a groundswell of kind of all of us coming together and just trying to do the best we could. I will tell you, by the way, we have so much talent in New Jersey that we could really have done a multi-hour event, but we stuck with the 1 hour because I think that's what we needed, and it might have gotten old after, you know, an hour.
Not at all, because I heard so many people who believe they're celebrities who said, hey, what about me? Well, that'll happen down the road.
Listen, I mean, we really did. We really have so much talent here, and that was one of the things. You know, New Jersey sometimes gets knocked around a little bit, and we should be, you know, we should have real pride in everything we do here. I mean, we've got an awesome state, awesome talent, and all those people who are on the front lines and doing all the right things for our state right now. Just everybody coming together. Couldn't have done it without everybody.
Let me ask you, as we put this site up again, as I speak right now, as we're speaking right now, if someone wants to help, easy enough to go on the website, make a contribution, and those dollars will go directly to an organization, a not-for-profit, if you will, right?
Mm-hmm. Yes.
That's making a difference, particularly around COVID-19.
Yeah. Yep, it's true. We actually are really fortunate because one of our board members is underwriting all the administrative expenses for the fund. So that means every dollar that comes in goes right back out into our communities in need.
You know, there's so many difficult aspects of this for all of our families, for your family as well. And by the way, we wish Governor Murphy, who came back after serious surgery, significant surgery, I'm sure a lot sooner than he expected or wanted to, but he's been there every day, and you and your family. But we're all trying to make a difference. Well, put it this way, all of us should be trying to make a difference. And we actually work with the Russell Berry Foundation on an initiative called Making a Difference, where they recognize people who are making a difference. To what degree do you believe that that's all of our responsibilities, not just the First Lady, the Governor, the Russell Berry Foundation? All of us need to be making a difference in the lives of others while we're trying to protect ourselves.
Listen, it's absolutely incumbent upon each of us to do what we can to help out. And, you know, what we can each individually do is different. You know, 129 donors for our fund gave a significant amount of money. They gave $10,000 or more. But we have over 55,000 donors. And that's someone who gave $1 to, right on up.
Yep.
So, and the lion's share of the money we've raised is on the backs of people contributing a little bit to the fund. But there's other ways, people are going to work each day, just showing up at work each day, just staying home and doing the right thing in the social distancing time to help flatten the curve. Everybody can do something. And it's just a matter of figuring out ways that you can help and that are in your slipstream.
Tammy Murphy is not just the First Lady of the Garden State, New Jersey, but she's also the founding chair of the New Jersey Pandemic Relief Fund. You've seen the website up throughout this program. Check it out. It's making a difference, a big difference in the lives of others. I want to thank you so much. You honor us by being with us. We look forward to seeing you again, hopefully at Drum Thwacket down the road.
I look forward to it. That would be great. Thanks so much for having me, Steve.
All the best to you and your family. Thank you.
Okay, great. You too.
I'm Steve Adubato. We thank you so much for joining us. Most importantly, stay safe, be well. See you next time.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by the Russell Berry Foundation, Horizon Blue Cross Blue Shield of New Jersey, PSE&G, GIBBONS PC, the Port Authority of New York and New Jersey, the North Ward Center, the New Jersey Economic Development Authority, Fedway Associates, Inc., Wells Fargo. And by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. And by Employers Association of New Jersey. Promotional support provided by NorthJersey.com and Local IQ. And by ROINJ. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
When I started working with children with autism over 25 years ago, my mission began. Autism is a multifaceted spectrum condition which challenges our system of standard norms. What autism has taught me is that there is no cookie-cutter child. Our differences ought to be celebrated, not separated. So today, take a moment to say hi or smile at someone who might be a bit different. Acceptance starts with you.